Good day, everyone. My name is Trisha Angie Martinico from BSN 2D, and today I will be discussing the proper assisting and handling the delivery. So first is the procedure, preparation and action of the student nurse in assisting the delivery. First is to prepare the equipment. Get an OB pack and place it in the Mayo table. It is to save time and energy. Next is to check the OB pack. You must check all the instruments if it is complete to have a smooth baling procedure. Open the outer lining of the OB pack. You can use your bare hands in opening it. And use the sterile picking forceps in opening the inner lining of the OB pack, because it is to preserve the sterility and to avoid the contamination. The next is to prepare the additional OB equipment. You must put all the instruments in an open OB pack to aid in doing the procedures. The instruments includes the following. In the OB pack consists of digital thermometer, sterile gloves, adult and baby diapers, one bottle of 70% alcohol solution, one bottle of betadine solution, and then bonnets and ID bracelets, which is pink for girls and blue for boys. And in the OR pack consists of 3 gowns and drapes, 2 leggings, 1 perennial sport, and a towel. Before doing the assisting, perform the surgical hand washing to avoid the introducing of the microorganisms in the designated sterile field. Then perform the gloving and gowning technique. The nurse must strictly follow the principles by maintaining a distance far from the sterile area to preserve the sterile field during the procedure. Because the feet of the mother is dirty, cover the foot of the mother and then pick up the leggings. And tuck in your sterile gloves inside the drape to avoid contamination of microorganisms. Do the same procedure to the other leg of the mother. Put the abdominal drape in the mother because it is where the baby is placed after birth. And lastly, the assisting nurse will arrange the equipment according to the sequence of the delivery of the baby, to have smooth sailing procedure and to save time and energy. The instruments that are used are, first, the bandage scissor. It is used to cut the perineum wide opening in the delivery of the baby. After the baby is delivered, the nurse must prepare the Kelly forceps. So the Kelly forceps is used to clamp the umbilical cords. Then is the surgical scissors. It is the most common used in the hospitals. This kind of scissors is used to cut the umbilical cord. The next is the needle holder. It is used by the doctor to repair the perineal area. Tissue forceps without teeth. It is used to hold the large tissues, while the tissue forceps with teeth are used to hold the soft tissues in the perineal area of the body. During the episiotomy, the assisting nurse will open the syringe and then the plastic. Make sure that the plastic will not touch the syringe, and then drop the syringe in the sterile area. After that, drop the plastic. We can use our bare hands. It's okay not to use gloves. So this is the 10cc syringe where the lidocaine anesthesia is being put during episiotomy. In the cord clamp, we should open it by the slit and then drop it in the sterile field. So the cord clamp is used to cut the umbilical cord to prevent the blood loss of the baby. Open the operating sponge like how you open the sterile gloves and drop it in the sterile field. So the operating sponge is used to absorb the blood and fluid. The operating nurse arranges the instruments in the Mayo table. So it consists of 10cc syringe with lidocaine and then surgical and bandage scissors. So the cord clamp, the Kelly forceps, curved forceps, the Kelly straight forceps, the tissue forceps, which has a teeth, and then the tissue forceps without teeth, the bulb syringe, which is operational, the placental bowl, and the operating sponge. So the assisting nurse will support the perineum to prevent the laceration when the baby is fully moving out. Grab the support towel once the baby is fully out in the pail. So the assisting nurse must serve the syringe with lidocaine and then move the cup out. So in delivering the placenta, the assisting nurse rolled the placental cord in the curved forceps. Observes the signs of placental separations, which is the shape of fundus, and firm, which is calcaneus signs, the gush of blood, and the lengthening of the cord. So there are two ways in delivering the placenta. The Brandt and Drus maneuver first. So the dominant hand is on the abdomen of the mother, and the dominant hand applies friction by moving it up, down, left, and right, and slowly pull the cord. The non-dominant hand is placed in the hypogastric area. Just pull the cord, place the placenta in the placental bowl. So you must check the complete parts of the placenta. So after the delivery of the placenta, the circulating student nurse will check the BP of the mother. So the assisting nurse will serve the hydrochloride lidocaine to the doctor that will serve as a anesthesia to the perineal area. Move the cup of the needle and then serve and give the operating sponge. Place the needle to close the cup. Serve the prepared needle holder with needle and then the tissue forceps without teeth. That is used for the perineal muscle. So serve another operating sponge if the doctor asks for it. Then afterwards, serve the tissue forceps with teeth that is used for suturing the skin. The next is to serve the surgical scissor. Wipe the instruments with operating sponge and arrange them back where it is placed. The student assisting nurse assists the doctor in suturing the episiotomy. Afterwards, the student assisting nurse cuts the thread with the surgical scissors with blunt area pointing downward and sharp and facing upward. The assisting student nurse rinses the perineum and apply the betadine solution. Serves as the dressing to prevent perineum from entry of bacteria. And that would be all. Thank you.